I just wanted to briefly mention the other phase 3 trial that was presented at ASCO 2019 and also updated at San Antonio, which was the SOPHIA study that looked at a novel HER2 targeted antibody with chemotherapy versus trastuzumab and chemotherapy in patients who'd received prior pertuzumab, and 90% had received prior TDM1. And margetuximab is an FC engineered antibody, and the FC portion of the antibody binds to the receptor, and basically there are different IgG FC gamma receptors. Some have more affinity for the antibody, some have lower affinity for the antibody, and this particular engineering was designed to try and increase the affinity for the increase the binding for the low affinity activating FC gamma receptor, which is CD16A, and decrease affinity for the inhibitory FC gamma receptors. So it's actually really interesting, sort of an engineering of an antibody to try and activate the immune response, and that's been shown in preclinical studies. So SOPHIA randomized these patients who had heavily pretreated disease to receive margetuximab or trastuzumab with a chemotherapy. The central blinded analysis progression-free survival was significantly longer, but the difference was only 0.9 months, the p-value 0.03. So it's interesting. I mean, you meet an endpoint, but the difference is very narrow in terms of the sort of clinical impact. We actually had updated the investigator-assessed progression-free survival as of September of 2019, and in that the difference was a little broader with an absolute difference that was more than 1 month, but it's still pretty narrow. The hazard ratio was a little bit better. The drug is very well tolerated, but the greatest interest in margetuximab was actually looking to see what happened in patients who had this low affinity IgG FC gamma CD16A genotype, which is called F, the allele F. And so either you would have, be homozygous or heterozygous for F. And if they looked at this group of patients for progression-free survival and overall survival, it looked like you really widened the gap. In other words, the improvement of margetuximab appeared to be primarily in this group of patients who has a low affinity F genotype. So very, very interesting data, and but difficult to understand exactly how it's going to play a role in terms of all of these other therapies, but it still may play a role in the later line setting. And then there is a lot of interest in studying the antibody specifically in patients who have the F allele, which is actually a large majority of patients. So it would be really interesting. So go ahead.
I'll just ask you a quick question about that. I think one of the things that you're alluding to there is that, maybe up front, looking at the patients who are less likely to respond to trastuzumab because they have the allele that makes them less, their tumor has the allele that makes them less sensitive to that therapy. So really not so much trying so later line like the SOPHIA trial was, but moving this up earlier, we might actually see greater benefits.
And that is a proposed trial, actually, from Dana-Farber by Ian Kropp to look actually specifically at patients who have the F allele and randomize them to margetuximab or trastuzumab, because we certainly learned that margetuximab was as good. In a phase 1 trial, some patients stayed on margetuximab for over 4 years, and they were heavily pretreated refractory disease. So I think it's worthwhile pursuing and looking more to try and understand where to place this in our armamentarium of HER2 targeted therapies. And of course, we're still waiting for the final overall survival analysis from that trial as well. So it's interesting.